Actually, the CCC program was formed in what I like to say is an organic way. We were working with clergy and congregations almost from the very first day that I started here. We had a skill set that not many other people had. We knew what it was like, at least most of us did, what it was like to be active in leadership of congregations. We knew what it was like, many of us, to be religious professionals and the isolation that so many religious professionals feel, despite the fact that they're with people all the time. We were seeing more and more pastors and religious professionals who were struggling with the profession as it became harder to support churches and congregations, as it became harder to get lay leaders in congregations to dedicate themselves to service. We also began to get requests from congregations and parishes to come in and to do leadership development with sessions and vestries and church councils, as well as to mediate conflict between lay leaders and religious professionals, or sometimes between religious professionals and fellow staff members. Those are tough ones because these are very dedicated people who sometimes have very strong opinions about what leadership and congregational life is all about, but they have to work together and they don't always agree. We've dubbed the program the CCC program, and that stands for Clergy and Congregational Care. The Samaritan Institute provided the framework for that niche. They did some groundbreaking work with the support of the Lilly Foundation to identify what congregations and religious professionals needed in order to thrive. The Stewart family became involved in supporting care and counseling, and specifically the Clergy and Congregational Care program. Thelma and David Stewart are very faithful members of Salem United Methodist Church, and they have been aware of the need for religious professionals to get training and support and consultation. And as Thelma Stewart, when she was on our board of directors for about 6 years, became more acquainted with the work that we do at Care and Counseling with religious professionals and with congregations. She and her husband David became excited about this work and dedicated themselves to supporting and underwriting the work that we're doing with very generous financial contributions, both through the family foundation, the Stewart Family Foundation, and through worldwide technology. I want to deepen our ability to work with clergy and congregations because denominations and local clergy leaders have fewer and fewer resources to work with. And I believe they're going to be turning to us more and more. So I want to help train our staff to do that work and to do it well.